Hi, Dr. Ramsey Choucair, board-certified plastic surgeon here in Dallas, Texas, coming to you with another video about facial plastic surgery. Today we're going to talk specifically about the eyebrow and the upper eyelid and how that all relates to aging. And the first thing you have to determine is how do you assess what needs to be done. And this area can be very complicated, in my opinion, as far as what to do. It's not complicated in doing it, it's what to do. So the first thing you assess is usually when you're looking at the upper eyes and the brow is the brow in the proper useful position? And I'll just start out by telling you in many cases as we get older, the brow looks like it drops, but it's really losing volume. So you have to look at the volume of the brow, because many times the brow will look a little low because it's lost volume. It's very rare that the brow needs to be significantly lifted. And many patients, especially women, will come in and say, my brow's too low, my brow's too low. And you show them photographs and of models in a magazine. The brow is no higher usually than many of the patients who come in. So educating patients regarding that. Now, sometimes they say, I still want my brow up. But the key is if your brow is too high, it doesn't look natural. And so we're very cautious about doing brow lifts these days. So we look at the volume of the brow, how much is it filled in, what position is it at, and then the final thing we look at is the upper eyelid skin. Is there excess upper eyelid skin, and does that need to be improved? So those are the three things we look at. Then there are many non-surgical attempts to make the upper eye and the brow look better. Obviously, everyone knows about Botox. Botox can help, of course, get rid of the furrow between the eyes, but Botox carefully placed around the crow's feet can elevate the brow to a modest amount and make a difference. Filler, like we've already talked about, to the brow, which can be done in the office with a blunt needle so there's very little bruising, can sometimes restore youth by just filling in the bony appearance. So fillers in the brow can certainly make a demonstrable difference in making the brow look a little fuller, and sometimes makes it look a little elevated by just simply filling it. So making the bone not look so bony is very important. It makes it look younger and softer when there's cushioning there. As far as brow lifts, again, because of Botox for the forehead lines and the lines between the eyes and elevation sometimes with Botox here, brow lifts are very uncommon, but when we do them, we typically are elevating the tail or the outer part of the brow because that looks more natural. Lifting the inner part of the brow can sometimes make you look very surprised. So it's very critical to move the brow in the right position, and usually it's only in the outer part. And then, of course, upper eyelid surgery, if there's excess skin, is one of the most simple procedures we do if that's all we need to do. Taking skin out and a little fatty tissue, if necessary, leaves an incision that's well hidden in the crease, is usually a very easy recovery under usually a very light oral anesthesia or minimal IV anesthesia. So upper eyelid surgery, if it's necessary, can be a significant change, and it's usually a genetic excess of skin that occurs. And finally, the thing that can sometimes make the whole orbit around the eye look more natural is the temples being hollow. If we fill the temples, if they're significantly hollow, you walk by someone and you register in your mind youthful appearance even without noticing why you're saying that. So significantly sunken temples can make someone look much older, and that can be done in the office exam room, and we usually use a filler for that. So in general, there are many facets to make the upper eye, the brow, look natural, and you have to really assess it in each individual and go through all the different options and determine what works for that patient and make sure that they are accomplishing what they want.